Welcome back to Dr. Dentico YouTube channel, and here we will discuss some things very interesting about dentistry which will help you to crack any type of examination. It can be your university examination and it can be your entrance examination. So today we will start with impaction, which is very basic but still important topic from oral surgery. This impaction we are going to see in our day-to-day routine life, right? So first, what are you knowing about impaction? In very short and sweet language, the tooth which is going to fail to erupt in oral cavity, right? This is a short and sweet meaning of impaction. But for theory purpose, we have to know what is the definition of impaction, right? So impaction is a failure of a tooth to erupt into fully functional position against its antagonist beyond its chronological age of eruption, even when root formation is complete. Okay, so we are going to discuss this definition by word to word. So first, what is failure of a tooth to erupt, right? This you know, right? Failure of a tooth to erupt into fully functional position. Okay, so what is fully functional position? It is a position that tooth will going to serve you a function, proper function, right, rather than interference against its antagonist. Antagonist means opposite tooth. Suppose we are talking about mandibular third molar, then what is antagonist? Maxillary third molar. Okay, so beyond its chronological age. So what is chronological age? The age in which age some tooth should be erupted. Okay, मतलब अगर हम बोल रहे हैं कि कैनाइन की इरप्शन एज इज 10 to 12 years, राइट? सो कैनाइन शुड गोइंग टू erupt in 10 to 12 years. If it is not going to erupt, then we have to diagnose about impaction, right? So it is a chronological age of eruption even when root formation is complete. In pedo, we already know whenever root formation is going to complete, then only tooth will erupt into oral cavity, right? Now we will moving towards the physical barriers. So what are the barriers which are going to interfere to eruption of the tooth? So we will learn about that. So first is our hard tissue barrier. Okay, first is our hard tissue and another one is our soft tissue. So in hard tissue, whenever we are talking about impaction, hard tissue which is for us is a bone. So which type of bone? Dense bone. Okay, so if you have learned about in oral pathology about osteoclast disease or anything, due to that bone resorption is affected, and if bone will not going to resorb, then how will tooth erupt? Okay, so this is our first tissue barrier, first physical barrier. Then we have a soft tissue. In soft tissue we have a dense mucosa. Some diseases related to fibroblasts, due to that mucosa will going to be dense. So because of this is creating a barrier to erupt a tooth. So now we are going to move to theories of impaction. So in this we have a first theory which name is a phylogenetic theory. Which theory? Phylogenetic. Okay, so in phylogenetic, what is base of this phylogenetic theory? So first, phylogenetic theory is based on evaluation. It is based on evaluation. So in some articles and some researches, it is proven that by the time with the evaluation we are going to lose our posterior most teeth. So it means we are in the stage of evaluation, right? That's why we have cases related to mandibular third molar impaction, maxillary canine impaction, right? So this is based on that evaluation. So once upon a time we have a 3 premolars, but right now we just have a 2 premolar. We all have 3 third premolar is lost, disappear from us. Okay, so this is evaluation. So it is mostly seen in third molars and maxillary canine. Okay, these are in stage of degeneration. These 2 teeth are in stage of degeneration. So I'm talking about posterior most teeth, right? So what are the posterior most teeth? If we are going to think about incisors, lateral incisor. Okay, lateral incisor is posterior most because central incisor is our anterior. Then in molars we have a third molar which is posterior most, and as I have told you, in premolars third premolar is disappeared. So in premolars third molar was posterior most, right? Now we will move towards the Mendelian theory. So whenever we listen a word about Mendelian, the second word which will come into our mind is genetics. Okay, so it is based on genetics. Okay, this theory is based on genetics. So whenever genetics is there, we have our mother and father. It means parents should be there, right? So suppose your first parent, it can be your mother or it can be your father. For example, here our first parent is mother and second parent is our father. Okay, so sorry, if your mother has a very small jaw but your father has very large teeth, so it is kind of rab ne bana di jodi. Okay, so this small jaw and large teeth, due to that tooth arch discrepancy will be there, right? So we have a discrepancy, and due to that we have a loss of space. Okay, and due to this reason tooth is not going to get enough space to erupt. That's why what is going to happen? Impaction. Okay, so this was about a Mendelian theory. Now the third theory, which is Nodine theory or disuse theory. In Nodine or disuse theory, it is based on civilization trend. Please check spelling once. Civilization trend. Okay, so इस थियरी में क्या बोला जा रहा है कि हम लोगों की लाइफस्टाइल चेंज हो चुकी है, राइट? वी डोंट लाइक दैट होम फूड, मतलब हमें बस जंक फूड खाना है. वी आर मूविंग टूवर्ड्स द पिज़्ज़ा, बर्गर्स एंड ऑल दोज थिंग्स, राइट? सो बिकॉज ऑफ दिस diet changing, we have a disusing our some teeth. Okay, we have a loss, we don't use that much of jaw. Okay, so it is based on civilization trend. Okay, so soft cooked diet requiring less mastication. Okay, that's why we are not using that much amount of forces and all those things. We are not using that much amount of jaw, and due to this less mastication we are disuse or less use of our jaws, right? That's why we are getting small jaws. And the same thing, because of small jaws, impaction, right? Because tooth are not going to get proper space for eruption. Okay, so this was about a theories. Now we are moving towards the indications. Okay, so in indications we have a first indication, which is our pericoronitis. First is our pericoronitis. So what is pericoronitis? It is nothing but inflammation of mucosa surrounding impacted tooth. Okay, mucosa surrounding impacted tooth. It can be of any tooth, but most commonly it is associated with mandibular third molar. Okay, so this is a pericoronitis. If you want to see pericoronitis, it's something look like this. Here we have a mandible, here we have our second molar, this is our first molar, and here we have our third molar, right, which is impacted. So on this mucosa is going to inflamed. Okay, this inflamed mucosa is our pericoronitis. Okay, now because of this patient will come to you, but most common complaint of patient is inflammation. Okay, as I told you, patient will come to you with pericoronitis, so most common thing for patient is inflammation rather than infection. Okay, inflammation is the most common complaint from the patient. Now we are moving towards the treatment of this pericoronitis. Okay, so what is treatment for this? So first we have to irrigate this thing. Okay, first is irrigation. Then we have to advise patient for what? Warm saline rinse. Okay, we have to give advice to patient for warm saline rinse, and also we can prescribe NSAIDs for pain. If patient have too much pain, we have to go with NSAIDs, and after this we can also prescribe antibiotics. For what we are giving antibiotics? For symptomatic treatment, like if patient has too much fever, high fever, and if patient has severe pain. Okay, for this we are going to give antibiotics. Okay, and after this we have a definitive treatment or the best treatment. What is the definitive treatment for impacted tooth or best treatment of impacted tooth? Is our removal. Okay, removal of this tooth, most commonly removal of third molar. Okay, rather than operculectomy. So what is operculectomy? Operculectomy is nothing but we are just going to remove that flap. Okay, so that patient will get some relief. Okay, but what is best treatment? Removal of third molar, right? Other than this, dental caries. Okay, so it will create dental caries to adjacent tooth. Okay, right? And then this is a complaint from patient, right? Dental caries to adjacent tooth, and sometimes we also can see bone loss around this. Okay, bone loss, and patient will also complain about chronic cheek biting, right? And it can be damage or resorption of adjacent tooth. Okay, it can damage to adjacent tooth. Then it will also can develop some pathology like cyst or tumor. This cyst, which is most commonly associated with this, is our dentigerous cyst. Okay, we will learn about this dentigerous cyst. Okay, so this was about a patient complaints. Okay, indications for removal of impacted tooth. Now after this we will also remove indication. What are other indication? Like orthodontic treatment, if patient want to ortho treatment, if patient want prosthodontic treatment. In this cases also we have to remove impacted molar, right? After this we are going to move second indication, which is about a prophylaxis. Okay, after this we have a prophylactic indications. Okay, prophylaxis. So in this, clinician or dentist, it means us, we already know that if this impacted molar will remain same, or impacted any tooth will remain same in this jaw, it will going to harm to patient. Okay, so it is advocated by us, it means advocated by clinician or dentist, advocated by clinicians to avoid ill effects of impacted tooth. Okay, for this reason we give advice patient to remove this impacted tooth. Okay, what are the indications of prophylaxis? Indications of prophylaxis. Okay, so in indications of prophylaxis, first we have a to save periodontium of second molar. Okay, we want to save periodontium of second molar and to avoid caries in adjacent tooth. Okay, other than this, to avoid angle fracture. This angle fracture is most commonly associated or most commonly seen in sports personalities. Okay, so in this we have to remove. Okay, then after this we are now going to talk about a contraindications. So what are the contraindications for a removal of impacted tooth? First is our generalized systemic contraindications. First is our generalized systemic contraindication. In this, first we have a diabetes mellitus, then we have a epilepsy, after this we have some asthma, and then we have a unstable angina. These are relative contraindications. It means if patient have some short surgeries requirement for from patient which is very needful for patient, then 19-20 चलता है. Okay, so we can go towards the removal of this tooth. Okay, after this we don't have to remove this third molar. It means contraindicated in cases of when third molar is not going to harm patient, Okay, if it is asymptomatic, then we don't want to remove this. Okay, so it should be asymptomatic. Okay, and very deeply seated. If it is very deeply seated, then we will get some fracture of that site, or we will damaging to that nerve. In these cases we will not going to remove because it is already asymptomatic. Then if third molar is going to serve a good function, okay, suppose one patient is there who does not have second molar or first molar. In this case third molar is very important for this function, for this patient, right? Because it will going to serve some functions about mastication, right? Then if now we will talk about a maxillary third molar. Okay, contraindication in maxillary third molar which is very deeply seated. In this cases, if we are going to remove this, we will just we can do fracture of maxillary tuberosity, and other than this another one is loss of bone from tuberosity. Okay, loss of bone from tuberosity. In this case we don't have to remove third molar. Okay, so this was about today's video. We have covered definition of impaction, then we have covered physical barriers, then we have covered theories of impaction, then Mendelian theory, then Nodine theory, then we have covered indication in this pericoronitis mean, prophylactic, and after this we have covered contraindication. Okay, So this was about today's video. Thank you so much for patience listening me, and if you want notes of this, kindly DM me on Instagram. I will provide you. I will give link in the description box for Instagram, and other than this I can give you ID on Instagram, which is Dr. Dentico. Okay, so Dr. Dentico by Dr. Devyani. Okay, you can find easily on Instagram. Okay, and if you have any suggestion or any doubt, please let me know in comment section. Okay, and other than this, you want any other video on any other topic, kindly DM me or comment me. Okay, thank you so much.